Pledge of Allegiance was a great segue to our next speaker, Congressman Paul Gosar. He's currently serving his second term in Congress as representative from Arizona's 4th Congressional District. He serves on the House Committee on Oversight and Government Reform, the House Natural Resources Committee, and he's a member of several healthcare caucuses. Before his election to Congress, Dr. Gosar owned his own dental practice in Flagstaff for 25 years. His exemplary service there in dentistry earned him the recognition as the Arizona Dental Association's Dentist of the Year, and he was also inducted into the Arizona Dental Association's Hall of Fame. As a healthcare provider and small business owner, Paul first began working to reform healthcare while serving as the president of the Arizona Dental Association and as the vice chair of the American Dental Association's Council on Governmental Affairs. He has opposed, as one of our panelists said earlier today, and affectionately known as Obamacare, he's opposed that bill and is working on solutions to replace it. This includes his co-sponsorship of H.R. 523, which would repeal the estimated $20 billion medical device tax found in the ACA and ensure that we keep medical innovation jobs here in the U.S. During the last congressional session, Paul worked with Bio and supported the Jobs Act. This act makes the pathway to capital formation more attainable for small biotechnology companies, clearing the way for American innovation and ingenuity by removing bureaucratic hurdles and red tape to speed cures and medical breakthroughs for patients. Finally, the FDA Safety and Innovation Act also passed the House with Gosar's support and became law on July 9, 2012. This law allows more rapid drug development and review process through increased transparency and scientific dialogue, advanced regulatory science, and strengthens post-market surveillance, as well as providing patients and doctors with earlier access to breakthrough therapies. Please join me in welcoming a principled statesman, leader, and my friend, Congressman Paul Gosar.
Well, thank you. This is how I got involved in politics, is over a meal and being able to sit with the governors and U.S. senators. So thank you. Glenn, thank you for having me. Joan as well. I guess what I'm going to be here today is tell you a little bit about a federal update. But I also want to tell you thank you from the bottom of my heart for making me feel like I'm back home again. I was a dentist who was very, very progressive in how I treated my patients. I was one of the first dentists working with implants, working with compressed ceramics, resorbable membranes, non-resorbable membranes. So I feel very at home right here. So what I thought today, what everybody wanted me to talk about is what's the state of what's happening with Obamacare, and particularly two parts, and that is the IPAB board and the repeal of the medical device tax. But before I start there, one of the biggest critics has always said, well, if you're not for Obamacare, what are you for? And as a dentist, I'm strategically and economically placed properly, because dentistry offers great solutions in regards to how a healthcare system can work. Over the last 30 years, our price index has gone up just the same rate as inflation, whereas medicine has gone up 20%. So how about a simplified outline of what we want to replace Obamacare with? How about competition along the marketplaces? Everywhere, from hospitals to physicians to insurance companies. Number two is, how about redefining the public health mantra and where they fit into this process? They're part of the problem, and they can be part of the solution. Third is tort reform, working compassionately with states' rights like Bob Thorpe and the governor of the state, so that we empower states to have tort reform, to have that competitive nature, and backdrop it with the Federal Tort Claims Act. And fourth, last but not least, is having insurance reform that a patient can deduct what they actually spend on their health care as tax deductible and let the free markets begin. It actually works. Look at LASIK. Look at the cost of new crowns and implants. They all drop because there's competition in the marketplace. So let's talk about Obamacare. It's not what I envisioned as healthcare reform, and I'm very much against it. I'm one of the most outspoken critics of it. And particularly when you look at the last couple weeks, it's going to become more and more frightening about what's coming. Obamacare has nothing to do with healthcare in itself and its delivery. It's about taking over 1/6 of our national economy. It's a series of taxes, because you're seeing one of those taxes in the medical device tax. But what's come to light has been actually the implementation of how do you do that. And a 3-letter word, which is very scary to everybody, is now coming forward, called the IRS. You've seen what the IRS has done over the last 2 years in targeting and leaking information, from the Koch brothers to Mitt Romney, to those that were considered patriots or 9/12 or libertarians, whatever. You even see it continue today with the revelation that one existed on May 6th of this very year, where they've actually targeted individual groups in this country. Last Tuesday, we actually had a hearing, and that hearing was overshadowed by what happened on Wednesday. But for this group, it's very, very important to understand what happened. There was a discovery about actually who's going to sell this product for the exchanges. They're called navigators and assisters. These are the people that will come to your businesses, will come to you as individuals, come to your employees to sell you health care plans. They could be a convicted felon. Seriously, there are no prerequisites for the job, other than they take a 20 to 30-hour course repeatedly online. They will be entitled to your Social Security number and your tax information and access to your business records. That will all go into an IRS data bank. I hope you now see the danger of what's going forward. The IRS is going to be in charge of implementing that process. In fact, the lady that was in charge of implementing the disclosure on special interest groups has now been moved over to the IRS to implement the IRS implementation of Obamacare. And by the way, make no mistake, the president does have his fingers here. Miss Ingram, the lady that's in charge, received over $100,000 of bonuses over the last 3 years. That size of bonus can only have one supervisory exemption. It has to come from the president himself. So you read between the labels. Here's where it comes. Let's morph this into the IPAB board. I think that's something that all of us that are looking at patient care and making lifestyles, increasing lifetimes, and making sure that healthcare is appropriately priced. The IPAB board is an egregious action by 15 unelected bureaucrats that will have very limited scope in how they pay. This could have implications on Medicare Part B and Part D, reimbursement models to hospitals, reimbursement models to physicians. Folks, if you haven't talked to your physicians right, starting in 2014, we may lose 50% of our population of physicians because they can't stay in business. How much further do you have to drop the prices? How much further do we have to have a government-dictated healthcare system? It doesn't work. Yes, I can quote that, because the group of people who have been on government-dictated healthcare systems the longest are actually exempt from the ACA. They actually happen to be the Native Americans. The Native Americans, through the Self-Determination Act, can create their own healthcare system based on their tribal population. We are actually doing it with them. They're actually taking Indian Health Service money, building nice hospitals, and privatizing with doctors and research. They want a patient-centered, patient-friendly healthcare system, which is what I was always brought up to be. The IPAB board is an egregious action. There is bipartisan support to get rid of it. Let's also look at the medical device tax. This is an egregious 2.3% gross tax on those medical innovations all the way across the board. I'm a businessman. I understand the profit margins on business. It's very, very small, particularly in an innovative science industry that's so competitive as yourself. 2.3% gross tax puts most of you out of business. It does not work. It too has bipartisan flavor for repeal. So let me ask you, or tell you, give you some insights about how do we see this playing out this year. Those are two of the things that actually can be repealed. And I'll give you the advantage of when they may possibly have come forward. In the Republican conference, as well as in the Democratic conference, we're going to be looking at a non-budget year where we're going to be putting together an omnibus bill coming by the end of September. There'll probably be about 6 appropriation bills with it. 2 of the line items with Obamacare are the repeal of the iPad board and the repeal of the medical device tax. This is going to be the opportunity that is the greatest opportunity for them to be repealed and put into legislation and removed. With one caution. We definitely need to have something in place to give us a competitive edge. And that's where 2 pieces of legislation I've actually put forward actually come into play. One, for most of you that may not know, is that the federal government is exempt from breaking up monopolies in the insurance industry. I'm very astute in that aspect, and it's called McCarran-Ferguson. It's something I've been very instrumental in before I went to Congress. If you talk to your state legislators and your state insurance commissioners, they have a hard problem of regulating the big insurance companies. They're really multinational. This allows the federal government or the FTC to compete equally against HHS in regards to giving you choice. Instead of a single payer plan, it gives you choice. Nothing more, nothing less, giving you opportunities for choice in your medical insurance. The second bill is good faith and credit of an insurance policy. For example, when you buy, if you're a husband and wife, you work for the same company, you get 2 insurance companies, or 2 premiums. One becomes a primary, one becomes a secondary. After the copayment, the first primary may pick up to 50% of that reimbursement policy. But the secondary is always subjugated. It never pays the same amount that the primary does, but you pay equally for it. What this bill does is basically say if you're paying that policy of equal value, get the equal value of that policy not to exceed 100%. What's more rewarding to the patient? Instilling a free market price, making sure they get full faith and credit of a process or product that they're given, and making sure that they do have choice in the marketplace. It actually does work. So there are opportunities, that they're limited opportunities. Glenn highlighted some of the things that we wanted to make sure for you as business. We want to make sure that we streamline the process for the innovative spirit that you actually all show. I, as a clinician, and my patients benefited greatly from all those aspects. Think about what we can do with cancer. Think of where we can go with pathogens. And one of the ladies I just got a chance to meet is going to be the sole provider of how do we look at rat population control. I'll tell you what, when you think about this, this has a huge implication in disease propagation, looking at how do we control a nuisance, how do we look at food supply safeties. There's lots of implication. But I'm also looking at, the nuances of where do we go with RNA and DNA and the discovery of how do we tackle cancer. The new developments in what we look at heart disease, looking at obesity. There's so many opportunities, and I see some of our brightest students here looking in that realm. The life sciences for me were a wonderful aspect, and they still are. I just tell everybody I'm a dentist impersonating a politician. Oh, and people are threatened by a dentist being in Congress because I'm happy to pull teeth, but it shouldn't come down to that. But folks, this is where the relationship always begins, is that you've got the great ideas. What I've seen from Congress in my brief history of 2.5 years is the great ideas don't emulate or start in Washington, D.C. They start right here. Your innovation, your great ideas, your sound business ethic, the entrepreneurial spirit that you always bring to the table, that's what's really required. And in order to get that scientific method, that proliferation of new ideas in science, new advances in healthcare going, we need to hear from you. More enact, Joan, Glenn, all of you need to come forward with your great ideas. Because as I was always told as a kid, who knows if it's your idea that turns everybody loose? Because that is the opportunity that we're faced with. Too many people look at this as our darkest hour. I actually think it's an opportunity to our brightest hour. We just have to have the gumption, the fortitude, and the entrepreneurial spirit to say, hey, I've got an idea. Here's how we can work. Here's how we can correct the system. Thank you so very much for having me have the opportunity to speak with you. I'm just a phone call away. My staff is always available, so if you have ideas, we'd love to hear you. Thank you so very much.